The gallbladder has the innermost layer which is called as the mucosa, and the outermost covering is called as the serosa. So when the tumor lies in between the mucosa and the serosa, that is confined in the walls of the gallbladder, then it can be either T1 or T2. But when the tumor goes beyond the serosa, that is outside of the gallbladder wall, then it can be either T3 or T4. So we call it T1 when the tumor involves up to the muscle layer. So when the tumor involves the lamina propria, we call it T1A, and if the tumor involves up to the muscle layer, we call it T1B. If the tumor involves the perimuscular connective tissue, we call it T2. The T2 is divided into two categories, one T2A and T2B. If the tumor involving the perimuscular connective tissue lies over the peritoneal side, then we call it T2A. Similarly, if the tumor that occupies the perimuscular connective tissue and lies over the hepatic side but not involving the liver, then we call it T2B. If the tumor involves beyond the serosa, goes beyond the serosa, then it can be either T3 or T4. So if the tumor involves either one of the major uh, veins or the arteries, we call it T4. For example, main portal vein or the hepatic artery. But if the tumor involves more than one extrahepatic organ, for example, in this case, we see that the tumor has involved the duodenum and the colon together. So as more than two extrahepatic organs are involved, again we call it T4. However, if the tumor involves the liver, then we call it T3, and tumor involves the extrahepatic bile duct, then we call it T3, and if tumor does not involve more than one extrahepatic organ, for example, just involves either the duodenum or the pancreas or the stomach or the colon or the omentum, that is only one organ, then we call it T3. If up to three regional lymph nodes are involved, we call it N1. If it is more than three regional lymph nodes, then we call it N2. If there is present of distant metastasis, we call it M1. If there is no distant metastasis, we call it M0. Thank you.